Sexual dysfunction and how it causes infertility. This is a problem which is amazingly common, and if you want to find out how you can solve this for yourself, please watch this video. I'm Dr. Malpani. I'm an IVF specialist at Malpani Infertility Clinic, and our website is at www.drmalpani.com. Sexual dysfunction is one of those taboo topics which no one talks about. Not only do they not talk about it, the second order consequences of sexual dysfunction is that couples can't have a baby. You're childless, you're labeled as being infertile, though technically you're not, because the definition of infertility is inability to have a baby after trying in the bedroom for 1 year. But here the problem is you can't even try to have a baby because you can't have baby making sex because of the sexual dysfunction. Now, sexual dysfunction typically, obviously, since it involves two to tango, is either a male problem or a female problem. With the man, it's either premature ejaculation, which is amazingly common but not talked about, which means the man gets sexually excited, gets an erection, and ejaculates so quickly that he cannot deposit sperms inside the vagina. He ejaculates even before he can put the erect penis inside the vagina, as a result of which the semen goes outside the vagina. And there's no way it can possibly go through the cervix, through the uterus, through the fallopian tubes into the eggs. And he gets extremely frustrated because he can't control it. He doesn't know what to do about it. And lots of men don't even know the word is called premature ejaculation. And treatment is hard because it's not a physical problem, it's a psychological problem. And treating it is extremely difficult. And they don't know what to do. And they go to a gynecologist who's often equally clueless. But this is one of those elephants in the room which need to be addressed. The good news is that it's very easy to treat infertility caused as a result of premature ejaculation, or technically I should say childlessness caused because of premature ejaculation. Because all the man needs to do is to ejaculate outside the vagina, which is something he can do very well and very quickly, and then the sperm needs to be deposited inside the woman's vagina, so that instead of using a penis to do that, you're using an instrument. Now, often this is done in the doctor's clinic. The doctor uses an instrument called a catheter to do what is called an artificial insemination. And the pregnancy rates with this technique of artificial insemination for treating couples who are childless because they have premature ejaculation is extremely high. Hardly surprising, because the sperm count's fine, the woman is fine, everything's okay. It's just bypassing that barrier of putting the sperms in the vagina, which the doctor does very efficiently. The good news is that you don't need to go to a doctor for an artificial insemination. You can do a self-insemination yourself in your own bedroom at home using our self-insemination kit. This is easily available on our website. You can order it online. The website is www.drmalpani.com, and we're happy to courier it for you. And we have all the instructions you possibly require. Very straightforward, really. So, it's not complex at all. I understand, talking about things like the vagina and premature ejaculation and sperm are still taboo topics, but if you want a baby, you better get over all these hang-ups. And you can learn to do it for yourself. You really don't require any assistance from anyone. The procedure is simple enough that all the man needs to do is ejaculate, collect the semen in a container. We provide you all this. It's sterile, wrapped, everything is safe. And you then need to use a special plastic sterile pasture pipette, which we send you, to collect the semen in the pipette and then deposit it inside the vagina. Simple, child's play, anyone can do it. The trick, of course, is that you need to do it during what is called the fertile period, or the ovulation phase, which means just before you ovulate, when there's lots of cervical mucus, and you can track ovulation using ovulation prediction test kits or your cervical mucus. And if you're not sure how to do this, please come to our website or send me an email. It's a free service we provide to educate you as to how you can take control of your own fertility, and you can actually do the self-inseminations. Now, you may need to do 3 or 4 self-inseminations during one cycle to maximize your chance of getting pregnant in that cycle, and have realistic expectations. This is not a Hindi film that it's going to work the first cycle, but if you are willing to be patient, your chance of getting pregnant within 3 cycles are better than 70%. So hang in there, and we'll be very happy to help you have a baby. And the great thing is, you don't need to come to us. We will come to you by providing you with the self-insemination kit for yourself, so you can do it yourself and have a baby. Look forward to seeing you on the website.